My name is Jennifer Nelson, Virginia Institute of Government Assistant Director for Membership and Engagement. The Virginia Institute of Government is leadership development and community engagement arm of the Weldon Cooper Center for Public Service at the University of Virginia. Through our research, leadership development programs, and local government engagement initiatives, we continue to work toward our vision of good governance, equity, and resilience in every Virginia community. State agencies and local governments can access a range of consultation and support services to build more resilient organizations. We have a team of seasoned public sector leaders and subject matter experts ready and available to facilitate boards of supervisors, city and town councils, leadership teams, strategic planning retreats, and other events. Today, VIG is glad to partner with the Opioid Abatement Authority for this special session for state agencies. Few housekeeping notes. This session will be recorded and posted on the Weldon Cooper Center for Public Services YouTube channel soon. If you have a question, please type them in the chat and I will ask them afterwards for you. Thanks again for taking time to join us today for this special state agency session. There will be two more available, one on Wednesday, May 24th, and then second one on Thursday, June 15th. Both will begin at 10:30 a.m. Now I'm happy to turn things over to the authority's Director of Operations, Charlie Linticum. Charlie?
Thanks, Jennifer. And thanks to Jennifer and all of her coworkers and cohort at the Virginia Institute for Government. They have been partnering with us for what feels like quite some time when you've only been basically an operating agency for a little over 6 months. So we appreciate the support that you have been providing and continue to provide us. As said, I'm Charlie Linticum. I'm the Director of Operations for the Opioid Abatement Authority. And what that means for us is that I oversee all of our kind of award processes as far as developing RFP for the state agencies, as well as like grant applications for localities and whatnot. So I'm going to real quick give a quick thumbnail overview of a little bit of the OAA structure in the state agency RFP. Many of you may have already read through this, but I know some, in case some have not, just to kind of set the tone, and then we'll jump into the Q&A. All right, so what is the Opioid Abatement Authority, if you're not familiar? So the Opioid Abatement Authority was established by the General Assembly in 2021 as an independent entity to abate and remediate the opioid epidemic in the Commonwealth through financial support from the Opioid Abatement Fund in the form of grants, donations, and other assistance for efforts to treat, prevent, reduce opioid use disorder and misuse of the opioids in the Commonwealth. So when the Commonwealth settles with the various companies, the Commonwealth has been signing on to the national settlements from all the different opioid manufacturers and distributors and other groups in the pipeline, and those funds come to Virginia. We are part of the management of those funds, and I'll talk about that distribution a little bit further down. So we serve to build partnerships with Virginia cities, counties, and state agencies and providers of service to assist individuals suffering from opioid use disorder, co-occurring substance use, and mental illness disorders. Partnerships address the full range of services like education, substance abuse prevention, treatment, and recovery supports. As of note, the OAA can only award funds to cities, counties, and state agencies because the localities and the state were the main parties to the lawsuits. I could probably talk for an hour just on the structure of the lawsuits, but the biggest note that you should have is, if you're not aware, is that these opioid settlements are like the most complex civil case in the history of the United States, more complex than the tobacco settlements even. So the OAA is, as mentioned, is an independent body. So we function kind of like an independent state agency. We are overseen by a board of directors, the bulk of which are appointed by the governor. They appoint our executive director, and we all report up through him. So our board is made up of a designee from the Senate, Senator Todd Pillion, who also serves as our chair. We have Dr. Sarah Melton, who is a clinical pharmacist and a professor of pharmacy practice for the Grafton College of Pharmacy at East Tennessee State. She serves as our vice chair. Jim Holland from the Chesterfield Board of Supervisors is our treasurer. Tim Spencer, who's the city attorney from Roanoke, is our secretary. The Health and Human Resources Secretary, John Littell, or his designee, serves as well. And Delegate Jason Ballard from the House. We also have Dr. James Thompson from the Master Sitter for Addiction Medicine, where he is a co-founder and the chief medical officer. And we have Sharon Buckman from the Piedmont Community Service Board. So we have part of the layout in the code is, that we'll have people in these kind of different buckets of professional experience in the area of opioid use, substance use disorder. So Ms. Buckman represents a rural community service board. And we have Darrell Washington from the Fairfax Community Service Board, represented an urban one. And we have Sheriff Joe Barron from the city of Norfolk. And then we have Mike Tillum, who is the founder of the Journey House Recovery from the recovery community. So when funds come in, so when the Commonwealth agrees to participate in a settlement, and thus far every settlement we've agreed to participate in, all of the localities in 100% of the localities in Virginia have also agreed to participate. The money comes in and kind of gets broken up into these big three buckets here. So there's 30% that goes directly to cities and counties to be used for abatement work. And then there's 15%, which is shown here as the Commonwealth share. So this actually goes straight to the state. And neither of these two buckets over here pass through the Opioid Abatement Authority. So we do not have any control over these. They go straight to their recipient. There's a bill that just passed in this most recent session that actually puts this money into a different special fund called the Commonwealth Opioid Abatement and Remediation Fund. Did I get that right, Adam? Yes, thank you. Or we call the core fund. That puts restrictions that it specifically has to be used for opioid abatement and remediation projects. And then 55% comes to the Opioid Abatement Authority and goes into the Opioid Abatement Fund. And our 55% is then statutorily broken up into these four buckets. So we have 15% that is set aside for each individual city and county. We have 35% that is set aside for what we're calling collaborative partnerships of multiple cities and counties. Then you have the part that we're talking about here today, which is the 15% that is also set aside for state agencies. And then the 35% unrestricted, this is where the board may create additional awards like in these three categories and be able to be, increase awards or be more creative than what may be initially laid out. One of the things that we've done, many of the city and counties aren't used to working in mental health, substance use disorder prevention, or treatment services, those types of areas. So they're needing more time to get their feet under them. So we allocated some money out of the unrestricted, say the board did, and we've created like some planning grants for them to be able to kind of do needs assessment and figure out best and highest use and how to implement plans. And I should have mentioned this special fund here for the Commonwealth share. That's kind of available to go through the normal appropriations process, like through the governor, through the introduced budget, or through the General Assembly budget process. So on to the RFP process that we are using to solicit proposals from state agencies for funding opportunities for abatement projects. So high level, kind of look through the structure. We're looking for one proposal per agency. The proposal may have multiple projects, but if it does, they must be ranked. And we have a form on our website, which I'll show you in a minute, that kind of is like a cover sheet that gives you the opportunity to kind of rank those priorities. Our proposal window opened on April 21st and closes on June 21st. The amount available this year for award is $8 million. No single agency will receive all $8 million. So we will be, looking at all the proposals that come in. The part of the code also requires us to distribute monies on an equitable basis across the Commonwealth. So what that looks like will kind of depend on what kind of proposals that we will see. So, but don't, obviously most of the state agencies are based here in Richmond. We're thinking about where the benefit will be seen. Is it in targeted communities or projects that you are submitting, going to be available to help the state as a whole? We'll have to kind of evaluate those all together. Proposals can range from 1 to 5 years. Funding is sustainable into future years. Our board has elected to adopt a measured approach. So the revenues come in at all kinds of different levels. Some of the settling companies have these balloon payments up front. And so what we've done is kind of taken those and spread them out over multiple years, so that instead of having like 25 million available one year and then 1 million available the next year, we'll have kind of a steady state of 8, and then it'll probably 8 million this year, and will probably be similar or kind of slowly decline. All of the settlements over time kind of go down little by little till they get to the end. The longest settlement we have is for 18 years, of which we've received 2 years worth of payments thus far. But so we should be able to see multi-year projects, and hopefully, up to, maybe at least 15 years worth of projects in the long run. So there we have a list of pre-prescribed performance measures. You must select at least one from there as part of your proposal. I'm happy if you select more. You may also have additional ones yourself that you want to include, and that's certainly fine. One thing about this that's different than maybe some other proposals you may have dealt with, this is requirements of the code, no supplanting and no indirect costs. So if you're building a program, it needs to be new, or it needs to be expansion of something that exists. You can't use this money to kind of backfill, cut down general fund expenditures. There's already money that's been kind of appropriated for it. Then you can't replace it with this. So, and no indirect costs, but you can have new administrative costs. So, if you take, you can't take 10% off of an existingly funded, procurement person to do an RFP as part of your proposal. That would be supplanting and indirect cost. But if you think that you've got, a lot of accounting work to manage, payments that you may be making with the funds that come out of this, and you want to increase the hours of a wage employee, those additional hours could be counted as part of the project. So if you get to the point that you're looking to do something like this, and you're trying to figure out the best way to do it, please feel free to reach out to us, and we're happy to kind of help you work through what does and doesn't work in this space. So after the proposal window closes, that we'll have evaluation meetings with each agency. We may do some negotiation of scope and budget and things like that based on what was submitted and what we're seeing. All awards have to be approved by our board's grants committee. And for those that are awarded, then we will work on developing an MOU to kind of finalize the details of the award. So there's what qualifies as a state agency. So we've done some diving into this to make sure that we spread the opportunity as far as possible. But we kind of found like a 4-point test. So was the entity created by an act of the General Assembly or the state constitution? Does it fulfill a statewide purpose? And does the General Assembly, Governor, Lieutenant Governor, Attorney General, or Supreme Court maintain some direct budgetary and managerial control over the entity? Is the agency funded primarily with state budget funds, which includes a state appropriated federal, special, or non-general revenues? So having worked in agencies that were primarily funded by federal dollars, while those weren't, state general fund dollars, the state still had to appropriate money for us to use those dollars, even if we had already received approval from the federal government. So basically anybody that's considered an executive branch agency would qualify. These qualifiers are meant to be more for independent agencies, and colleges and universities, they qualify and stuff. But if you're in kind of an odd bucket of an agency and you're not sure, please feel free to reach out. I've already had a few different groups reach out to make sure, if you find yourself, if you're laid out in the budget in the Appropriations Act, if there's a line for you in there, then you would qualify. So grants portal. So this is where we park all of our information. I'm not going to hit the hyperlink. I'll just get, here we go. So this is our website, which we try to keep updated very regularly. Lots of information here. So this is our grants portal. When you click to come here, you'll end up on this general page, and this is where our glossary of terms is, and I'll be working on updating the frequently asked questions after we get through this cycle, so that there'll be some stuff in the state agency bucket. So if you click on the state agencies group, then you see the introductory letter that I'm assuming most of you received, that maybe alerted you to this Q&A session. Here's the RFP and all of its details itself. As I mentioned, there's a, if you have multiple, regardless if you have multiple or not, but this is a kind of a cover sheet we'd like to see come in with the proposals. And if you have multiple projects, ranking their, how many there are. If you have more than 5, let us know. We'll figure out what the best way, probably just have you submit an additional sheet and kind of cross out the numbers here. And we also have, there's a project timeline workbook, and this is the performance measures workbook. And here's our terms and conditions. And then there's a checklist that just kind of tells you everything that you should have, because proposals, when they are at the ready to be submitted, they're just coming through as documents attached to an email to our info@voaa.us email there. And that's also listed in the checklist here at the bottom. So, as you can see, if you haven't had a chance to look at the RFP itself, we have a general introduction, the purpose of the proposal. Here's our eligibility section. I'm not going to read all of this to you. These are has our statements of priority, that this is the different types of areas that the board is looking to fund programs in. But if you have something that you are interested in or you've been working on, and it kind of meets the requirements of the Virginia Code and this Exhibit E document here, this you can find this in a couple places on our website. This is from the national settlements, and it talks and lays out all the different types of core strategies and approved remediation uses across various categories. So if you have something that meets up with both of these that you'd like to submit, we'll certainly consider it as well. This number 5 here goes through the requirements of the proposals and more the structure and the items that we're looking for. We're leaving this for you all to kind of write out in a form that works best for you. We need to, and as mentioned, then we need a there's a line item budget, and a brief narrative on the budget is required. Think about kind of the higher level of a budget workbook that you'd kind of present for like a decision package, something like that. I don't need the low detail of the object codes, kind of like by major object code or something like that, a major account code. Maybe I should use the updated terminology. And so a file like that, just kind of what you normally present to your leadership as part of a decision package. It's a completed project timeline workbook, completed performance measurement workbook. And then if you have any additional things, to link to our definitions. Then some general guidelines. So funds will be awarded yearly and on an upfront basis. This is not a reimbursement-based process. So you got to stay in compliance with our terms and conditions. If not, repayment of funds may be required. And then there's a few of the financial guidelines that primarily talks about the supplanting the indirect cost and the tests kind of for the allowable administrative costs. And I think most of the rest of this I've also covered. The evaluation criteria is down there as well. Let's come back here. All right. So amendments, carryover, and reporting. So once a project has been awarded, if the agency or the OA feel there needs to be some amendments to the project, we'll deal with that during the next. There'll be a renewal process each year. So you can have a proposal up to 5 years. If we approve a 5-year project, we'll basically make a 1-year award with 4 optional year renewals. You obviously have to stay in compliance with terms and conditions and meet our reporting requirements to be able to do that. but each year we'll have a proposal cycle that'll run from April 1 to June 1, and that would be the time that amendments could be to the process could be considered. If you have carryover from one year to another, we would also review that at the time. Carryover would need to be approved, as well as the amendments by the grants committee. Will be handled on a case-by-case basis. Kind of the simple things that would likely be approved if you're just having a timing issue, like with getting someone hired, or with a procurement that's just dragging from like one performance period to another. Those types of things. So, and also, I don't know that I wrote it in my slide deck, apologies, but the performance period for all these grants will be October through September. So when we get through this first award period, we expect to execute the MOUs and transmit the funds in October, and we'll end up kind of running alongside the federal fiscal year for these. Reporting requirements will be annual on forms prescribed by the OAA, which we have not had the time to develop yet. As mentioned, we've only been kind of up and running with staff a little over 6 months and developing lots of processes, but we will also kind of, work on those reporting requirements as part of the MOU. It's a lot easier to figure those requirements out once I see what it is that you're doing, and in future years, we'll have a more streamlined process for that. But the reports will need to include both like financial information on expenditures and how the prescribed performance measures were achieved. So this is my last slide. So here's our timeline. So the proposal window opened on April 21st. Here we are today at our first Q&A webinar. We'll have another one on May 24th and a third one on June 15th. If you received, the letter that went out with the announcement and the one that's on the website, I haven't had a chance to modify it yet. These are different dates that were not in there. There was a June 6th date that has been canceled. This has to do with the executive branch adding a step where their proposals for any executive branch agencies need to be submitted through their secretaries to the Secretary of Health and Human Resources by June 1st for a review. And so if you have questions on that, that is what the administration is elected to do. I don't oversee that process. So check with your, through your leadership and with your secretaries about what needs to happen there. But because of that, which wasn't part of our original assumption, we decided to have a Q&A not long before this due date, and then another one before the closing of the proposals, when you should know which ones the governor's office is elected to send forward. So you're going to have a chance for kind of last minute stuff before the proposals are due, and the proposal window closes on June 21st. We'll do our evaluation meetings and negotiations June 22nd through August 11th. Our award determinations will be made at our August 18th grants committee, and that is open to the public meeting that any of you all that are submitting are welcome to attend. And then we'll be finalizing and transmitting the MOU in October. As I mentioned, our subsequent proposal periods and renewal periods will be April 1 to June 1 of each year, with hoping to have awards determined by early August, and then with the award period still staying the October through September. I also welcome you to subscribe to our OAA news and updates email list that's on our website at the bottom of our homepage, which I can show you real quick. You just come into the voaa.us, scroll to the bottom, sign up right here, and we may be pushing additional information out through that method. And then here's my contact info. I am happy to help. This week might be next week might be a little tight because our grant application period for localities closes this week, and there's lots and lots of questions at having, and we have we're expecting to have a lot of applications to look through. But as time comes available, I will be available as quick as I can, or refer you to one of our other employees here. So that is I'll leave this up. People want to take any notes off of this, and I will open it up for questions.
When the RFP mentions prevention, is it referring to primary prevention? For instance, preventing people from ever starting opioids, or is it referring to the prevention of opioid overdoses?
Either. So you could be doing like a schools-based prevention program to help kids understand the dangers and make good decisions and those types of things. Or you could be doing naloxone distribution and education. Either of those would fit into the category. That Exhibit E will help you can also help you narrow down kind of the broader categories of that.
Very good. Could you please clarify what is meant by completed project proposal for each project? This can be in a format of the agency's choosing on page 7 of the RFP. Also, is there a page limit for the RFP?
There's not a page limit. I'm not looking for a large book, but I also, want to know what it is that you're, tell me the story of what you're trying to do and how you're meeting all the, the requirements and the qualifications that are laid out there. So completed project proposal. So that's kind of the main element of the RFP. So you've got to have your proposal is all the stuff that's in. Let me go back and just pull it up. I can. Visuals are always more helpful. So the proposal would include how you're meeting one or more of these items listed in the statement of priorities and scope here in item 4. And it would include everything here that is the requirements of the proposal here in section 5, including and then additionally attached with that would be your line item detail budget, your timeline workbook, your performance measure workbook. And then if you have any other supporting documentations or narrative materials, if you're expanding, as far as limits, if you have like additional kind of, like if you're expanding a program that already exists and you have some type of write-up or literature that explains the program, and then your proposal can more focus on how you're explaining, you can attach that already existing write-up as kind of an additional document and kind of point us to it through your narrative.
Good. Can proposals include staffing costs so there is no supplantation?
Yes, it can include staffing costs. However, I would work through your administration and probably with your DPB analyst to determine what that may look like for you all, is from like a maximum employment level standpoint. We can't control that. We know that we've gotten clarity from the Department of Planning and Budget that when an award is made, that the funds will be transferred to the agency, and DPB will move the appropriation from the OAA over to the receiving agency. The mechanics of getting a position without going through the Appropriation Act, I think they're going to deal with on a case-by-case basis. If you want to submit positions from our end, yes, we would accept those, but I would talk through your administration side to make sure that you've got if that's something you're going to do, that you've got the green light to make sure you can get the MEL without cannibalizing, in something that's already existing.
Very good. So do colleges and universities qualify to apply for consideration? Are there any differences between public and private institutions?
Private institutions would not be considered an agency of the state, but public colleges and universities would, and community colleges.
Good. Will there be any further guidance about the depth and breadth of the reporting requirements? Would help to have some idea of what is needed, what will be needed resource-wise to meet these requirements.
Understand. I think the financial is going to be comparing your expenditures to what your budget is that you submitted, and then the performance measures is we're looking for data that shows how you did or possibly didn't meet or possibly exceeded the goals that were set out, and especially in those pre-prescribed measures. So kind of like to say, begin with the end in mind. You might, as you're thinking about what it is you want to put together for your proposals, look at those performance measures and think about what you've got in place or would need to put in place to be able to substantiate to me. Think about substantiating to an auditor. Really, it's kind of the long view of it. how did you measure this, and how are you telling me that you got to here? Because that would be questions we would be asking. I apologize for not having more stuff. I am reticent to build something that when I get a bunch of proposals that we really like and we want to award, and my process doesn't work because we're just so brand new here. Like I said, Adam, our finance director, who's also on here, started 2 weeks before I did. We both just passed our 6 months marks, and we've been building like crazy. So I don't know if I will have something between now and the end of the proposal period, but it will certainly take more into context that information as we're negotiating the MOU process.
Very good. While I'm waiting for more questions to come in, people can put those in the chat. Just wanted to remind people that we do have sessions on May 24th and 15th. And let me put up
June 15th.
Sorry, June 15th. I'm putting a URL in the chat. People can just register for that by taking that snap. Please know that I'm going to be sending a follow-up email once this video recording is available. It will include some of the links that Charlie talked about to the grants portal, as well as contact information on how to get added to the listserv, and links to the video.
Yep. And we'll also post this to our website as well, and I'll include it in one of our news updates when it's posted. So.
Very good.
I can also offer that if you've, so we're, without trying to say we're the government, we're here to help, because we're actually all, if we're all having this conversation, we're all some level of government. We know that this is, this being such a new process and this kind of learning as we go as well. We're happy to kind of work with you through what your proposals that you're working on, and provide feedback or review, or if you've got a group of people trying to figure out something, you want to kick some things around with us, we're happy to give feedback from our viewpoint. Obviously, you have your administration's viewpoint as well, the governor's administration that you have to work within. But helping you does not mean that your proposal will be awarded, but it will make, we'll do as much as we can for everybody to help make sure the proposals are in the best possible position to be considered amongst the others. So we're happy to be able to do that. We've been doing lots of that for 133 localities of recent. So it'll be decidedly less number, I think, of state agencies we would have to support. But we are more than open to chat and talk anytime.
Okay, no more questions have come into the chat. So I just want to thank you, Charlie and Adam, for holding this session today for state agencies.